Good evening and welcome to the COVID-19 update program on Channels Television. I'm Millicent Wonka. First, the highlights. Delta State thrown into mourning as Majority Leader of the House of Assembly dies of COVID-19 complications. Nasarawa State re-strategizes to flatten the coronavirus spike as Governor Sule initiates awareness campaigns. And South African President says 50 million doses of vaccines will be available for use on the continent come April 2021. More cases of the coronavirus have been recorded across Nigeria in the last 24 hours. The Nigeria Center for Disease Control, NCDC, confirmed 1,861 new cases and 22 deaths. This has also led to the increase in the total number of active cases, which you can see that stands at 24,251, with the latest numbers pushing the total confirmed figures to 126,160. However, it is good news as the number of recoveries have surpassed 100,000, but the death toll is now 1,544. The new cases are reported from 21 states, with Lagos recording the highest, 773, followed by the FCT, 285 cases. Oyo as well recorded over 100 cases, so also did Rivers. Plateau recorded 92, Nasarawa 83, Kano is next at 59, Enugu as well, 57 cases were recorded in Enugu and also in Imo State. Edo followed suit with 43, followed by Kano, 27 cases. 20 were recorded in Kwara, and you can see all the other states recording cases there in Nigeria. Still in West Africa, Senegal recorded its first case of the more contagious coronavirus strain that initially emerged in Britain. The director of the health research body there during a press conference said that people must be very carefully now, follow the various precautions since these variants are transmitted more rapidly. In the meantime, outside Africa, reports from Wuhan shows that a team of World Health Organization experts have left a 2-week quarantine, starting a delayed closely watched probe into the origins of the coronavirus. Members of the group, all wearing face masks, got onto a bus which zipped them away from the hotel where they had spent their mandatory quarantine. The WHO insists the visit will be tightly tethered to the science of how the virus, which has killed more than 2 million people and laid waste to the global economy, jumped from animals to humans. And again, South Africa's President Cyril Ramaphosa is making a case for African countries to benefit from the supply of affordable COVID-19 vaccines between now and April 2021. Speaking today at the Virtual African Union Conference, he explains that already 280 million vaccine doses is being purchased for the continent through contributions from private sector partners, with 50 million of the 280 million vaccines to be available by April 2021.
African countries to immunize their target groups. We are calling on the World Trade Organization to waive specific TRIPS obligations related to the prevention and treatment of COVID-19 for a defined period. We need more countries to support this initiative. This would enable countries in Africa and elsewhere to access active pharmaceutical ingredients and benefit from technology transfer, including the know-how to manufacture vaccines in Africa at a much cheaper cost. We have secured a provisional 280 million vaccine doses for African countries through the task team. At least 50 million will be available from April to June 2021. These doses are from 3 major suppliers: Pfizer, AstraZeneca, through the Serum Institute of India, and Johnson & Johnson. Because of the high cost of vaccines, the task team has arranged with Afri-Exim Bank to support member states who want to access these vaccines based on a whole of Africa approach.
South Africa President Cyril Ramaphosa speaking there. Back home, the reality of the existence of the coronavirus is one that many Nigerians must take seriously, especially with the rising number of deaths, sadly among them the death of a prominent Delta State lawmaker. With the spike of confirmed cases in the second wave, the government and school authorities in Delta State say they are doing all that is necessary to control the spread of the virus.
In the early hours of today, residents of Delta State woke up to the news that the majority leader of the Delta State House of Assembly, Honorable Tim Owefere, had passed on. Owefere, a fourth-time member of the Delta Assembly, reportedly died of coronavirus-related complications at the Federal Medical Center, Asaba, where he had been undergoing treatment for a while. Before now, the Delta State government had ordered the reopening of schools in the state with conditions that all schools must adhere to safety protocols. Most schools, such as this one, have taken it as a matter of responsibility to ensure that all pupils and teachers are checked, masked up and hand sanitized before they are allowed into the premises.
If there's a way they can do the testing so that teachers can also get tested, since they are the ones that are with our children every day, so that we don't know where they are going to, who they are meeting, so there's a way they can maybe make it compulsory for teachers to get tested. It will really make parents be at peace.
Inside the classrooms, teachers are also cautious of the virus as teaching and learning go on.
Coronavirus is an airborne disease, that's why we are wearing face masks, so we don't breathe in the disease.
The school is also on the lookout for cases of children coming in with fever and other COVID-related symptoms.
I'll just say that everybody should know that it's real. It's not something, some people still don't want to believe it, but we should all know that it's real and we should take care of ourselves. If you think you are asymptomatic, for example, you don't know what other side effects it might have on you in years to come. So avoid anything that you need to, whatever it is that the guidelines that is being laid out, avoid them as much as possible and keep yourself safe.
Meanwhile, in the marketplace, caution is being thrown to the wind as a lot of people here appear nonchalant about the happenings around them. Buying and selling without the use of face masks and social distancing completely ignored. According to the NCDC, Delta State has a total number of 2,249 confirmed cases. Of this number, 460 cases are active, 1,737 already discharged, with over 50 deaths recorded. The latest being the majority leader of Delta State House of Assembly.
Let's talk some more about what's happening in Delta State. And joining me is Dr. Victor Osayatuma. He's the CMD Federal Medical Center at Asaba. Thank you for joining us on the program.
Well, a pleasure to be here.
The last time I spoke to you, that was during the first wave, and now here we are again. What's your take on this new wave, especially how it's hitting Delta State?
Well, the new wave, like we're experiencing in other parts of the country, is on a steady increase, on a steady rise. And the hospitals are almost being stretched to capacity. As I speak to you, all the beds in our isolation treatment center are fully occupied. And some patients are now being managed in the private facility, even unknowingly, and that makes it worse. So at the time they refer to us, the patients are even coming in very bad. And, some of them with pneumonias that have been tagged community-acquired pneumonias, which by the time we screen them, we find out that they have been dealing with COVID. And so IPC, follow-up and all of that has been a little challenge for the number of staff on ground. But by and large, we're trying to see how we can cope with all of this. with the support we are getting from the federal government and the state government as well.
I mean, the health crisis is being felt across the world. Looking at perhaps those who are most vulnerable, I know you've mentioned some pre-existing illnesses. When we hear someone has died from COVID-19 complications, what exactly does that mean? And what are some of the ways that Nigerians can protect the most vulnerable in these times?
Well, what it means is those that are most vulnerable are most likely to succumb are those that have comorbidities like diabetes, like hypertension, like renal diseases or liver diseases. It becomes difficult for the body to fight the infection, and so it becomes easy to fall prey. But for those who do not have that, they have more immunity and have more ability to fight and have better chances of surviving. In the United States, quite a number of people have some of these comorbidities. At least most of the ones that we have lost had comorbidities. Only very few, less than 5%, didn't have comorbidities. So we say they are COVID-related deaths because actually they died from severity of those comorbidities, but the ability of the body to recover from them becomes difficult because the COVID weakens the body's immune response system. So that's what we've been experiencing.
You talked about the ICU units being almost full to capacity, beds running out. I mean, looking at the markets in Asaba, it appears there is a flagrant disregard of some of the protocols or the measures that you would expect Nigerians, Deltans, to take into consideration. Does this give you concern?
It does give us concern, and the state government is looking into it seriously because we have also made our concerns known that the public places, the market in particular, they are not observing any of the measures. You see the face mask is been turned into a chain mask. Even if they put it on at all, it's in a chain. Nobody bothers to cover the face, the nose and the mouth. And it's difficult getting people to comply now. Some of them still are living in the past, believing that the COVID is not real and that is only a propaganda. And that is the most difficult thing to deal with right now. People are making the job a lot more difficult with their attitude and their behavior. You go to shopping malls, the whole place is filled to brim. People are not observing these protocols, and I think we need to press a little harder now, because if we can put these measures in place, it will help to a large extent to reduce the number of infections we're getting per day. So we need to do more to enforce all of this.
Some of the solutions we've been told, other than the non-pharmaceutical protocols, are tests and, of course, the right treatments and then the vaccines. Some people have complained that they've not had access to tests for COVID-19. It appears to be slow. How do you think that can be solved?
Well, NCDC and the federal government has made more testing centers available. Before now, we had just one at the Asaba Specialist Hospital, but now we have 4 across the state. We at the Federal Medical Center, we're testing now. The Warri Central Hospital, they are testing, and at the Delta State University, Abraka, Ogara, they are also testing. So 4 testing centers. So we have increased testing capability now. Just that we cannot test everybody. We still don't have the capacity to test everybody. So we are still selecting our cases. The patients are priority. Those that have symptoms are priority. Those that are exposed are priority. And then, IPC follow-up. So we cannot test everybody that comes to the hospital. We cannot test everybody that comes to the public place for now, even though we have increased our testing capacity.
All right, we appreciate your time. Thank you for the update. We've been speaking to Dr. Victor Osaituma, CMD, Federal Medical Center, Asaba. Thank you for joining us on the program.
Thank you. Have a good week.
The COVID-19 pandemic protocols of hand washing or sanitizing where you cannot wash your hands, wearing the face mask, physical distancing has become the new normal to prevent the spread of the disease. Almost every year in Kano State, the Harmattan weather comes with cold, wind and dust. But there is a difference this time, as this year in the ancient city, our correspondent Nanchin Vincent reports of increased consciousness as more and more people are putting on the face mask to stay healthy this season. Take a look.
Not much was known about the now popular surgical and cloth mask until the outbreak of the COVID-19 pandemic, which gave rise to compliance of safety protocols, including wearing of face mask. In Kano, wearing of face mask is becoming a norm as the residents see it as the best way to keep themselves safe from not just COVID-19 but also the harshness of the Harmattan.
No, we are wearing masks because of Harmattan and Co. Because all this corona they have been saying, we have never seen one up to today.
According to the Nigerian Meteorological Agency on Thursday, January 28, 2021, Kano is experiencing a temperature of 26 degrees Celsius with a 12% humidity, while the wind is blowing at 26 km per hour. Hence, proper use of face mask is important.
By the time you put the face mask like this, then you have the infection and you don't want another person to inhale the infection. So you cover it like this. So, but now you see people are putting face mask, so they will cover the mouth, nose, eye, face, the whole thing. You see different type of face mask. You see. And this face mask, I told you the advantage is very protective, Maria.
Medical experts are advising the use of face masks in public places as it limits the risk of getting infected by any airborne disease. The Harmattan season makes the situation worse. From Kano, Nanchin Vincent, Channels Television News.
Unlike a few other states in Nigeria, Nasarawa State is experiencing an increase in the number of confirmed cases. According to the state governor, this is due to increased testing. However, he's calling for adherence to these safety protocols. Our correspondent Halima Gam has this update.
As the second wave of the coronavirus keeps on attacking, the state is encountering a spike in the number of confirmed cases. Governor Abdullahi Sule attributes this to an upscale in testing capacity as he gives a breakdown of cases right from the first wave.
Nasarawa State has continued again to receive some escalation in numbers, but this is expected because we have increased the number of tests that we are conducting. We have also significantly increased the number of people that we are testing every day.
A number of residents have continued to flout safety protocols. The governor has initiated several awareness strategies, with the latest one with all district heads. He has re-echoed the call for adherence.
So I'm using the opportunity to call on the good people of Nasarawa State, to continue to maintain the COVID-19 protocols in order to reduce the challenges we are having.
The government cannot fight the pandemic alone. The people also have a huge role to play. All government's efforts cannot be successful if the people do not comply. Halima Gayam for COVID-19 updates.
Well, Dr. Adamu Ibrahim is the Director of Public Health, Ministry of Health, Nasarawa State. He joins us now for more on the situation. Thank you for joining us on the program. We heard from the Governor of Nasarawa State. Some of the numbers, though, have gone up because as at today, the NCDC is reporting a total number of 1,720 confirmed cases, and we have 1,382 that are undergoing treatment. But are you worried by the number of COVID-19 cases coming in from Nasarawa State?
Yeah, good evening, Nigeria. Yes, I am very, very worried, and all of us in Nasarawa State are very worried about the numbers of COVID-19 cases that we're getting. And we think it's not unconnected with the fact that towards the end of last year, a lot of people started letting down their guards. People are no longer complying with the preventive measures like use of face masks, frequent hand washing, and avoiding overcrowded situations. So we think that those are the factors that have contributed to this increasing number. In addition to the fact that we've also increased opportunities for testing. Before now, we had like 3 sample collection centers, but we have escalated that to now we have 15 sample collection centers, so people have more opportunities to go and get tested. And then before now, also we're not testing within the state. Samples have been taken outside the state to other labs, especially the NCDC lab at Gadwa. But now we can test within the Nasarawa State Infectious Disease Diagnosis and Research Center. So we think all these factors together are the reason why these numbers are on the rise.
So if testing is increasing, Nasarawa State as at today has the 3rd highest number of people that are undergoing treatment or isolation. What do you think is responsible for this? Or is it a case of patients not recovering fast enough?
Yeah, because we are confirming what we think, and of course, all those persons that are tested, at least will have to be in isolation or in treatment for a minimum of 14 days. So we think that is what is giving us these numbers. But if we're able to control the spread of infection further, and these numbers will begin to go down.
Dr. Adamu Ibrahim, so far it appears that about 80% of cases we hear are in 3 local government areas, Kefi, Lafia and Karu. But the governor did mention that a few other local governments are seeing more cases unexpectedly, like Akwanga, Doma. What's your take? Is it an issue of non-compliance? And what would you also advise for people who are living in these areas to limit the community spread?
Yes, the first 3 local governments you mentioned, Karu, Lafia, and Kefi, are actually the urban local governments in the states, and of course, it's not surprising that we have very large numbers from this very urban local governments. The other local governments, Akwanga, Doma, that are coming up, of course, is also not unconnected with the fact that people are no longer complying with the preventive measures. Like I said earlier, the use of face masks is very, very poor. People are found in clustered situations. The issue of physical distance is not being observed. People seldom practice hand washing as often as we expect them to do. During the first wave, we had organization, ministries, department, agencies.
Oh dear, for some reason, I think we've lost him. But we've been speaking to Dr. Adamu Ibrahim, the Director of Public Health Ministry of Health, Nasarawa State. We appreciate your time. Well, we did tell you the World Health Organization is calling for calm and patience while urging governments and manufacturers to work together to addressing teething problems of vaccine rollout. You can find more updates on our website. That's channelstv.com. There are loads of stories there, especially when you click on the coronavirus updates, and you can see that story there on your screen. There's several other stories on our website as well in politics, business and sports. And that's the program. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.